Hello, my name is Josie Dreyer, and I am an occupational therapy student at Grand Valley State University. In the following video, you will see me teaching you how to fabricate your own grab bar to increase bed mobility and positioning. My grab bar was inspired by the needs of my grandpa bar, who goes by Tony here. He not only has decreased superficial sensation due to a brain tumor that is located centrally in his brain, but he also has diabetes and he skin picks. This led me to realize that he also has decreased upper extremity strength. This limits his ability to position himself in a proper position to perform ADL activities while he is in bed. He is bedridden right now due to being 2 years on hospice. Before my grab bar, my grandpa bar was complaining about having more spills while he was eating and feeding himself in bed. When I asked him to show me how he positioned himself before eating, I saw that his right upper extremity was able to pull himself using the side grab bars a lot easier than his left. This caused his right hip to be elevated higher than his left and created a lean on his weaker side. Not only was he only able to use his right upper extremity during his feeding and eating activities, but his left one was being compressed against the side rails. Furthermore, my grandma was reporting problems performing hygiene activities for my grandpa, as he could only roll from side to side using his side grab bars and not up and down. Another barrier that I observed with Grandpa was that when he had family members visiting him, he had to have his side bars up so that he could pull himself up to get enough air to breathe. It also created a barrier for his face-to-face interactions and communications with others. When my grandpa bar first entered hospice, he was provided a trapeze structure to help him position in bed. However, due to the size of their living room, the trapeze created more of a barrier for my grandma, who was trying to maneuver around it instead of being a help. So Grandpa was forced to the limitations of just his sidebars. The big question for this project is, how can we address these limitations in this situation while also incorporating the raised effect that a trapeze provides for bed mobility? To help with this project, I turned to my local hardware, Gammons Ace Hardware store in Hudsonville, Michigan. With the help of a nice sales representative named Rick from Gammons, I was able to identify that a 2-foot-long, 1-inch PVC pipe would be perfect for my project. I didn't want the PVC pipe to bend and potentially snap while Grandpa was using it, but I also wanted it long enough so that he could use the pipe to pull himself up that was about the weight of his shoulders. Here you'll see me wrapping electrical tape around the pipe so that it provides a tactile cue for Grandpa to grab, but also a visual cue, as the ceiling above him is white and I wanted there to be a contrast on the bar. When I'm done wrapping the bar with the electrical tape, you can see that it is a visually distinct pattern. Grandpa should be able to grab this with no problem. I then attached 90-degree 1-inch elbow PVC joints on either end of the grab bar. This will help to give the grab bar a rounded edge while also helping to direct the tie-down straps that will be attached to the bed frame. Originally, I had bought one 6-foot tie-down strap that was intended to go through the length of the bar, so that I could create a triangle trapeze-like frame for my grab bar. However, I later noticed that the hook ends of my tie-down strap were too large to fit through the bar. So I had to adapt the way that I was going to plan how to use the tie-down straps. With help from Rick, we were able to determine that I could still create my grab bar. I just would have to buy a second tie-down strap and adjust the placement of where I would put the hooks. Here you can see that I had to slide one end of the tie-down strap hook through the elbow joint so that I was hooking the inside of the grab bar itself. To hook up my grab bar, I took one end of the tie-down strap and hooked it to the frame of my grandpa's bed. Then, making sure I didn't twist the strap, I went under and over Grandpa's headboard. This allows the grab bar to move up and down as Grandpa raises and lowers his bed. It is great for storage and convenient to take out of the way if my grandma ever needs to use it. You can go on down. Yep. Now my grandpa and I will demonstrate how he used the grab bar in the following video.
I'm seeing Grandpa. Perfect. So good at this. Oh, yes.
Here you see me handing Grandpa his remote. I want him to be an active member as we perform bed mobility together.
No, you're doing good.
Here I duck down to tighten Grandpa's straps just to make sure that they are long enough when he decides to position himself higher in the bed.
Oh, it went off.
Before handing Grandpa his grab bar, I remove the pillow to reduce the amount of friction that he will be encountering as he pulls himself up. I then hand it to him, grab the bed sheets, and count to 3 so that we can pull together. We were able to pull him up a good 3 inches higher in the bed. He was rather surprised that he could do that because he hasn't been able to in the past. This made me feel good. At the end of positioning Grandpa higher in the bed, I make sure to replace his pillow so that he can have a comfortable place to rest his head as we move him back up. So why is bed mobility and positioning important for this project? Well, we must consider who would benefit from this grab bar. This grab bar could potentially be used across the lifespan at home or inpatient settings. Diagnoses that could benefit from this include spinal cord injuries, traumatic brain injuries, amputees, people suffering from general deconditioning, and those on palliative care. One thing that this grab bar helps to improve is the safety of caregivers and healthcare workers, who are some of the most at-risk individuals for suffering an occupational musculoskeletal injury. This is due to the awkward positions they might use to try and lift a loved one or a patient for various bed positions. Also, utilizing adaptive equipment ensures the person in bed is contributing to the force needed to move them up in the bed, thus saving the back of the one helping them in the bed. Also, as a person ages, their skin becomes more frail and more susceptible to pressure sores if they are not continuously changing their position in bed. Especially for my grandpa, who spends every day in bed in skin picks and is on blood thinner, he must avoid developing blood pressure sores at all costs. Furthermore, when an individual sits up higher in their bed, this improves their respiration by opening up their chest and avoiding the slouching position that could depress their lungs. This causes shallow breathing. Finally, by utilizing this grab bar, we were able to achieve an equal elevation for Grandpa's hips in the bed. This ultimately prevented the uneven lean to his left side, thus offering him the ability to use both of his arms for bilateral coordination. His activity of choice following this repositioning up in bed was to eat a Frosty, and boy did he enjoy it. Here are some questions for you to consider. How might fabrication differ for a child using a grab bar? Also, what muscles are acting upon the grab bar? How does this grab bar change the angle and direction of force compared to using a trapeze? How about a side rail? Finally, how might you personalize a grab bar for a client?